Today we're gonna talk about why do we take X-ray. So I just got back from gym. I bumped into this super smart person who is studying for a master's in biology. We started chatting about various different matters, exercise, chiropractic, and biology, etc. Naturally, he mentioned some pain he's been feeling, which sounds like joint plus soft tissue matter to me. I asked if he ever been to chiropractic clinic and he said yes. He mentioned how they adjust the spine and check everything out in detail. But then he said something surprising. They don't do taking x-ray. He replied, that chiropractor can just feel everything. Really? While it is true that human hand has a lot of nerve endings, it is definitely not sensitive enough to detect everything inside of the body. The best chiropractic school in the world teach that taking x-rays before the first adjustment is essential to gather all the necessary information, along with other assessment. Some chiropractors even claim they can feel through shirts and sweatshirts, but that doesn't sound like reliable data to me. And then shifted gear and talk about radiation. In my clinic, we use high-tech, low-exposure x-ray machine. Yes, of course, we need solid figures to work with. Taking a pelvic view is equivalent to about 1 year and 3 months or 1 year and 6 months of radiation exposure in the natural environment. That sounds like a lot, but it is actually pretty small dosage. The chances of developing cancer from that radiation over 1.5 years are fairly low. Interestingly, some studies even suggest that exposure to low dose of radiation is boost your immune system. For example, there was a study on shipyard workers who were exposed to higher radiation level than like what you get now at home, work, during your commute, and they actually had a low cancer rate compared to general population. I hope nobody gets the wrong idea in that high radiation is good for you. The point is, we want to use the smallest amount of the radiation possible. Chiropractors should use x-rays to pinpoint problems or related issues. It is not just about finding segment to adjust. Most of the relevant data also comes from various examinations. About feeling everything from almighty hand, let's be real. The idea that chiropractors just feel through clothing is not very credible. Unless you're Superman, you don't have x-ray vision, period. Can anyone practicing without x-rays really say they have intra-reliable clinical evaluation? If you have 100 chiropractors looking at the same patient without an x-ray, what are the odds that they will find same issues? It is likely the result will be varies. If you think differently, feel free to comment below. Maybe I'm missing something in my life. On the flip side, when using Gonstead chiropractic method, if one patient is examined by 100 Gonstead chiropractors, the chances of them finding similar issues are incredibly high. Plus, X-ray can show how long someone has been dealing with the disc problem and help identify possible contraindications, like which area we should not touch. They can also reveal pathologies such as tumor or fractures and biomechanical limitation may be in your body, which is crucial for giving exercise advice based on your body's specific needs. I hope this gives you a clear understanding of why x-rays are important in chiropractic care. Remember, when it comes to your health and your family's health, safety and result matter.